We're going to be getting started. I'm Barry Hyman. I'll be talking about common injuries of the knee and shoulder. Injuries occur from sports injuries, overuse injuries, or traumatic injuries, although the sports injuries can also include overuse injuries in the sports and traumatic injuries in sports as well. And we'll talk about when to seek treatment and what are the treatment options. So the simple precautions, obviously you want to have sports as fun, but not dangerous. And you have to learn your limitations at times. So acute versus overuse injuries. Acute is sudden trauma, sprains, strains, bruises, fractures, and overuse are a series of repeated small injuries that eventually can become a bigger problem. So basically, there's adult injuries and children's injuries, and there are some things that are very similar. In 2007, just in general, sports injuries, there are about 500,000 football injuries, a little less basketball, about 276,000 or 77,000 baseball, softball injuries, 220,000 soccer injuries, and about 410,000 playground injuries. Young athletes are similar, but they're not small adults. And the difference is sometimes these growth plate injuries, where you can see the slide on the left, the child has open growth plates. Those are those lines which disappear when you're older, and you can actually they're weaker than ligaments, and sometimes you get an injury through the growth plates. And obviously, same age youth can be differ in size and physical maturity, whereas you have them playing at the same time. A bigger person can hurt the smaller person because of that. So when do you see the physician? Obviously, if you can't play anymore or decreased ability to play, you're not able to walk normally. You have loss of motion or swelling, visible deformity or severe pain. And obviously, if there's something that doesn't go away, that's a time to see a physician as well. Initial treatments for all injuries: rest, ice, compression, elevation, the Rice formula, modifying your athletic activity. And then as far as sporting injuries are concerned, there has to be cooperation, communication between everybody, between the patient, the coaches, physician, trainers, and in the case of children, parents. Then just through a slide on boomeritis. That's elderly sports, and there are more than 1 million sports-related injuries each year in the United States. Different types of injuries, difference between tendonitis, bursitis, strains, and sprains. Tendinitises are, the tendon is where the muscles attach to the bones, and they can get inflamed. Bursitis are areas of motion that are not joints. So this is a model of a shoulder. The shoulder joint is between the ball and the socket, but as I go like this, there are the things that squeeze between the top of the shoulder and this bone called the acromion, and there's a bursa there, and you can get a bursitis by going back and forth. With respect to the knee joint is here, you can get, when you bend, the skin can wrap along the upper portion of the knee, and you can get a bursa swelling between the skin and the patella. And that's a knee bursitis. There's an infrapatellar bursitis, there's a prepatellar bursitis, and those can get inflamed as well. Strains are ligament injuries. I'm sorry, strains are muscular injuries, sprains are ligament injuries. So if you twist your ankle and injure your ligament, that's an ankle sprain. If you injure the end of the muscle as it attaches to the bone, that's a strain. The therapy and the treatment is the same. The Rice theory, and then alter your sports activities, physical therapy, medication, and then maybe surgery. Preventing sports injuries, obviously, if young kids need to be well coached and supervised, proper equipment, play on safe surfaces, and should train for their sport prior to playing. Abide by rules, wear proper gear, know how to use equipment, and never play through pain. And these are also very true for adults as well. Preventing injuries, you want to make sure that your coach that you use is qualified, obviously for yourself or for your children. And always warm up first, either adults or young adults, young athletes, warm up first. You can warm up by just regular exercises, and then also a little warm up in the sport that you're going to be doing. Preventing sports injuries, obviously, the more skilled you are in instruction, the less chance you have of injury. Wearing safety gear, and year-round conditioning, not the weekend warrior where you do something and you haven't done it in a while. That often causes injuries. When you stretch, when you warm up, it's good to break a sweat. You can do marching, walking in place, jumping jacks, and then mimic the sport that you're going to be doing. In stretching, it says you should not feel pain. It's okay to feel just a little tad, otherwise you really won't get the stretch. So you're going to stretch, and then it's okay to find that there's just a little bit of tension. You want to hold for about 30 seconds and then relax, but not ballistic stretching, and you don't want to have a lot of pain when you stretch. Obviously, you want to breathe deeply, slowly, don't bounce, and both right and left sides equally. So let's go into some of the common sports injuries. Specifically, today we're going to talk about the shoulder and the knee. The only thing is, I did talk about the growth plates. I didn't have a picture of a knee or shoulder, but here in the wrist, you can see that those are the growth plates, and you can fracture through the growth plates. We talked about that earlier. You can have an injury for the ACL. That's one of the more common knee injuries that are quite consequential. That can be occurred by a direct blow. Even when you plant your foot and twist, that's another way that this can occur. Landing on a straight leg, abrupt stops, backseat skiing, and I was sitting very deep. There's also hyperextension injuries occur as well. Actually, for the incidence of ACL injuries are higher among female athletes, and there's a combination of causal factors. One is there's a theory that women are trained differently than men, and if you change the way they're trained and teach them how to jump in a different way, it's called neuromuscular prevention programs, that can prevent ACLs, and there's studies that show that as well. There may be some anatomical differences. There's something called the notch, where the ACL comes in, and women sometimes have more narrow notches, and that can lead to more impingement when the ACL hyperextends, causing some rubbing on the ACL. Well, we can get back to ACLs in a little bit, but the next common injury is meniscus. That's even more common than an ACL. The meniscus is like washers inside the knee. They're like two U-shaped. They're called cartilage, and they act like shock absorbers. And they're also common to planting and twisting injury, and along with some other injuries like clipping, which can get the MCL, medial collateral ligament, which is on the side, the meniscus, as well as the ACL. And it's very important in keeping the knee joint. Symptoms are pain, giving way, locking, clicking, swelling, and those are common for meniscus injuries. ACL is also giving way, but usually not necessarily the locking, clicking, swelling. So that's those are the knee injuries. We're going to come back again a little bit to treatment, but we're just going to go over the injuries themselves. The shoulder injuries, we've got traumatic shoulder dislocations, where the shoulder themselves the ball can come out of the socket. That's not a pleasant thing. to happen. If you're lucky and there's a healthcare provider on the field, such as a doctor, it can be reduced right away, and that's probably the best thing. But a lot of times, by the time people get to the ER, the muscles have tightened and it's much harder to do. And sometimes you need either sedation or sometimes you can do what's called the hematoma block, numb up the joint to get the reductions. Sometimes you need surgery after that. There's some different types of theories. There was a great West Point set of studies done for the cadets. The conclusion came that if you're a cadet and you dislocate your shoulder, you should have surgery immediately. So that prevents you from redislocating it later on with all the activities that you would do as a cadet. Now, a lot of other people in sports and sports doctors feel similar to that, although some people feel that if you dislocate your shoulder, wait till you have it a second time and then do it. If you're older, let's say you're over 30, there's a much less chance of dislocating if you're 15 or 20. And if you're 50 and you dislocate it, there's much less chance of redislocating it there as well. As you get older, though, you can also get combined tear injuries. So you can dislocate your shoulder and tear your rotator cuff. And that's where studies like an MRI are helpful. If you dislocate your shoulder the first time and decided not to have surgery, you want to strengthen the muscle around the shoulder. The shoulder dislocations occur often that you can tear the cartilage called the labrum, which is like an extension of the socket, which sits on the inside. And so the things that hold the shoulder is something called, other than the labrum, are the socket itself, and there's something called the capsule, which is this layer around the shoulder. By strengthening the shoulder, the muscles, it's called the dynamic stabilizers, can hold the cuff in place, where even if you have a labral tear or a stretched out capsule. So that's something that you can do. A lot of people can do. If they keep their shoulder strong, they won't dislocate again based on that. Now, there's some people who just don't want to exercise or just not for them, and they may need surgery if their shoulder keeps dislocating, if they can't do the strengthening exercises. But certainly it's a great way to protect people from dislocating. There's another group of people who are hyperflexible, and they can pop their shoulder out easily. And if they strengthen their rotator cuffs, they can often prevent that from coming out as well. Obviously, surgery is an answer. You can reattach the labrum, tighten up the capsule, and that works out very well. And that can be done either arthroscopically or open. Originally, people felt that open was better, but people have gotten really good at the arthroscopic treatments, and that's a good way of taking care of it, shoulder dislocations. Sometimes you have bony defects and you have to use different ways to affect that, but bony defects often come from people who keep dislocating. Another reason why you want to get it done sooner rather than later. So shoulder overuse injuries, tendinitis, throwing sports, weightlifting, and you want to make sure, if possible, use proper technique for lifting up weights. Some people say no pain, no gain. That works sometimes, but on the other hand, there's different types of pain. It's okay to have some muscular pain when you're just starting a sport. You'll feel some of that as long as you don't overdo it. But if you keep having pain, you shouldn't be doing that. You've got to listen to your body and slow down a little bit, because if you have continued tendinitis, it may become a tear, especially in the rotator cuff around the shoulder. Now, throwing sports, I've been taking care of the Renegades for over a quarter of a century, which is used to be a farm club for started with the Texas Rangers, then Tampa Bay, and now is the Yankees. And we've learned a lot in the throwing athlete, and almost all the pitchers, and now probably the catchers and a lot of the other throwing athletes do rotator cuff strengthening program with weights of 3 pounds or less to protect their shoulder. Once you use more than 3 pounds, you're firing your pecs and your deltoids, and you're not really working those small muscle groups. the rotator cuff and scapular stabilizers. So it's real important to practice that, and some simple exercises just by lifting your arm up and down or resisting against your own hand you can do easily, or back and forth. And I tell a lot of my patients, you get stopped at a traffic light, you've got a whole minute there, go ahead and do a couple of these cuff exercises, and that'll be good for at least your once or twice a day routine. So rotator cuff tears, again, acute or overuse. Some people will be lifting something or doing something and all of a sudden have a sharp pain and can't lift their arm up anymore. That's sort of classic for acute rotator cuff injury. And overuse, again, you can be the tennis player working on the serve and keep working on it until you get tendonitis and keep going through that. Even though there's pain, then you can get a cuff tear as well. So basically, they're common in occupations and sports that involve repetitive overhead motions. So throwing a ball, tennis are two that I mentioned, but some of the occupations as well, when you're working overhead, that can those are ones that people get rotator cuff tears. Stress fractures can occur with respect to the shoulder. A common one is actually throw-in injury, where you can either get a stress fracture of the proximal humerus, or sometimes you can get a growth plate injury if you're a young person, where through the growth plate of the shoulder, and those are common as well. For the runner, you can get them in the knee as well, especially as someone gets a little bit older. Women runners, sometimes if they're osteoporotic, can get a stress fracture around the knee or proximal tibia. So again, with overuse injuries, the treatment is reduce the intensity, warm up before, ice afterwards, and if you can, work with a coach, and that'll help. Again, there's a 10% rule. Don't increase your activity by more than 10% per week. And then questions about surgery. Why do surgery? What are the alternatives? What are the benefits? And for how long? Also the risks, procedure called, how does it perform, results, and then how long is it going to take to get better, which is very important. I let my rotator cuff patients know that 4 to 6 months before they're going to get better, and the ACL surgery, maybe a year before they're doing sports. It's important to understand that before undertaking the surgery, especially if you're a worker and you're using your arms and you're told that you can't do that for 4 to 6 months. That's tough. What's the alternative? The alternative is not having the surgery, but it's hard sometimes when you can't use your arm. What sort of help you need at home? Obviously, if you're in a sling, if things are a little bit tough for you, you're on crutches, things are tough. And so we talk about these things after the surgery. And therapy, sometimes we do things on their own. There's a famous shoulder surgeon named Dr. Rockwood. He wrote a lot of the textbooks. He called the therapists, unfortunately, he called them physical terrorists. And he sent nobody to physical therapy. He taught everybody what to do, and he got great results. I think if you have a therapist that knows your protocols, it can be very helpful to a patient, but also a lot of things that people can do on their own. And obviously you want to know when to return to normal activity. So it didn't talk about surgery so much, but just in general, going back to the knee, meniscus surgeries can take 15 minutes. And they're done in the local. I have some of my patients watch me when I do that if they want, and you don't have to watch. You can be asleep or under what's called local MAC. It's not a huge operation, and it's a very quick recovery for many people where they're walking right away, using their legs right away. And some people are better within a few weeks with it more than they were before. Sometimes it takes a little longer. If you have to repair a meniscus, that's going to take longer. ACLs are different. They take a long time. You could be walking normally, maybe within 2 weeks, but that graft that you use takes a long time to get better. Different types of grafts, you can use your own bodies. It's called an autograft. A patella tendon is very common, sometimes hamstring or quadriceps. And then you can use a cadaver graft, which is helpful. General rule of thumb these days is if you're over 25, it's okay to use a cadaver. If you're under 25, you should use your own graft. But different doctors do things differently. Obviously, whoever your doctor is will help you with those decisions. As far as shoulder surgery is concerned, there's fixing the labrum is a much quicker recovery than fixing the cuff. There's a couple other shoulder things we didn't talk about, and that's an AC joint separation. This is your clavicle. This is your acromion, and you can land either on the outstretched arm or right on your shoulder. And these things can pop up, sometimes minor and sometimes major. A lot of times you don't need surgery for that, and sometimes you do. But that's more a quicker recovery when you have that injury than it is a rotator cuff tear. Sports are fun. The goal is a pain injury-free balanced fitness program for all ages. These are some resources: the American Academy of Orthopedic Surgeons and American Orthopedic Society for Sports Medicine.